Flesh-eating bacteria appear in Florida. A growing danger? Hey everyone, today we're going to talk about a dangerous bacteria that's becoming more and more common, especially with the current climate change. You've probably heard of flesh-eating bacteria, a name that sounds really scary. But in reality, this is a type of bacteria that can actually be fatal if not treated in time. The bacteria we're talking about is vibrio. So what exactly is vibrio? It's a group of rod-shaped bacteria that usually live in seawater, mud, and particularly on the shells of marine animals like oysters, shrimp, and crabs. You might not know this, but some species of vibrio are responsible for serious diseases such as diarrhea, wound infections, and even sepsis. This becomes especially dangerous when we come into contact with contaminated seawater or eat raw seafood that hasn't been properly prepared. The impact of climate change. Imagine a warm summer afternoon, and you're standing on the beach, your feet splashing in the water. But did you know that the ocean water temperature is slowly rising each year due to climate change? This not only affects marine ecosystems, but also creates the perfect conditions for vibrio to thrive. This bacteria is moving further north from warm areas like the Gulf of Mexico to colder regions such as Alaska and Finland. Even extreme weather events like storms and heavy rainfall are causing changes in salinity and nutrient levels in seawater, creating an ideal environment for vibrio to multiply. What is flesh-eating bacteria? Flesh-eating bacteria is a common term used to describe bacteria that can quickly and severely attack and destroy soft tissue in the human body. The name flesh-eating comes from these bacteria's ability to eat or destroy body tissue, leading to rapid necrosis. The diseases caused by these bacteria are often referred to as necrotizing fasciitis, a life-threatening infection that can lead to death if not treated promptly. Types of bacteria associated with flesh-eating. Bacteria. 1. Vibrio vulnificus. Vibrio vulnificus is a type of bacteria within the vibrio group that causes severe infections, especially when humans come into contact with infected seawater or consume raw seafood. This bacteria causes tissue necrosis very quickly and can lead to sepsis. The illness can result in shock, intense inflammation, and widespread body tissue death, particularly in people with weakened immune systems. 2. Group A Streptococcus, GAS. Group A Streptococcus is a common type of bacteria that causes infections ranging from mild conditions like sore throats to more severe ones like necrotizing soft tissue infections, necrotizing fasciitis. This bacteria attacks rapidly and can lead to severe tissue necrosis of the skin and muscles. GAS typically starts with symptoms like fever, aches, and redness in the infected area, but it quickly progresses to deep infections that cause tissue death. The mechanism of disease for flesh-eating bacteria. Flesh-eating bacteria have the ability to grow and destroy soft tissue quickly through unique and powerful mechanisms. When they enter the body through open wounds or by consuming raw seafood, these bacteria release strong enzymes and toxins that damage surrounding cells and tissues. Soft tissue destruction. These bacteria secrete proteases, enzymes that break down proteins, hyaluronidase, enzymes that break down connective tissue cells, and other toxins that decompose the components of soft tissues. This leads to the rapid necrosis of skin, muscles, and connective tissue. Immune response. When the bacteria attack, the body responds to the toxins and bacteria, causing severe inflammation. However, because the bacteria grow too quickly, the immune system cannot cope in time, leading to the rapid destruction of tissues. Rapid necrosis. The bacteria can cause body cells to die, necrosis, within hours or days, depending on the severity of the infection. Necrotic tissue will be eaten away, leading to peeling skin, muscle necrosis, and even death if not treated promptly. Sepsis. One of the severe complications of this infection is the development of sepsis, a condition where bacteria enter the bloodstream and spread throughout the body. This leads to septic shock, low blood pressure, and organ failure. Why is Florida vulnerable to flesh-eating bacteria? Florida is one of the states with a tropical climate and a long coastline, making it an ideal destination for outdoor activities such as swimming, fishing, and beach vacations. However, because of its natural features and unique climate, Florida is also highly susceptible to dangerous bacteria, including flesh-eating bacteria such as Vibrio vulnificus and Group A Streptococcus. Warming seawater, an ideal environment for bacteria. One of the key factors making Florida vulnerable is the warming of seawater. Warm seawater creates favorable conditions for bacteria to thrive, especially Vibrio vulnificus, a bacteria that causes rapid tissue necrosis. The rising seawater temperature, due to climate change, has extended the summer season and raised the temperature throughout the year, creating an ideal environment for these bacteria to grow. When seawater temperatures exceed normal levels, the habitat for Vibrio bacteria becomes ideal. These bacteria thrive in warm temperatures, so exposure to contaminated seawater during hot summers increases the risk of infection. This is particularly dangerous for individuals with weakened immune systems or those who come into contact with seawater through open wounds. 2. The consequences of storms and poor drainage systems. Florida is a state frequently affected by tropical storms and major hurricanes. After each storm, flooding and poor drainage systems are key factors that increase the risk of bacterial infections. The heavy rains and storms not only cause flooding, but also wash away waste, chemicals, and bacteria into coastal areas and residential neighborhoods. Vibrio bacteria and other harmful bacteria can enter the body through open wounds when people come into contact with contaminated water or muddy environments. Additionally, poor drainage systems prevent water from draining quickly after a storm, creating an environment where bacteria can survive and thrive. This makes people in Florida more susceptible to dangerous infections if they are not cautious when coming into contact with water environments. 3. Florida's numerous lakes, swamps, and seas. High risk while swimming, fishing, and traveling. Florida is home to not only beaches but also many lakes, swamps, and other freshwater areas. These water sources can be ideal environments for the growth of Vibrio and other bacteria, especially during hot summer months. Many residents and tourists visit Florida to engage in outdoor activities like swimming, fishing, and taking coastal tours, and this is when bacteria can easily enter the body through open wounds. Swimming at natural beaches or participating in shore fishing activities can carry risks if proper precautions aren't taken. Clean and clear seawater can still become contaminated by waste from industrial activities, household waste, or debris from storms. Even small cuts or scratches can become entry points for bacteria, especially if not treated promptly. 4. The rise of tourism and outdoor activities. With its tropical climate and long coastline, Florida is a popular tourist destination year-round. However, the increase in tourist traffic also brings challenges in maintaining water cleanliness. Many people swim or engage in water sports without fully understanding the risks of bacterial infections, particularly from Vibrio. Therefore, raising public awareness about the potential dangers from seawater in swampy areas in Florida's tourist regions is crucial. Tourists and residents need to be informed about precautionary measures, including avoiding contact with seawater during storms, or when signs of contamination are present, properly cooking seafood, and quickly treating wounds when exposed to seawater. Conclusion. Florida is highly susceptible to flesh-eating bacteria due to a combination of factors, including warming seawater, tropical storms, poor drainage systems, and abundant natural water sources like lakes, swamps, and seas. All these factors create the ideal environment for bacteria to thrive and pose a serious health threat, especially during activities like swimming, fishing, and outdoor tourism. Awareness of these risks and preventive measures will help protect you and your family from the serious diseases caused by flesh-eating bacteria. The risk to humans. When it comes to Vibrio, What makes it a threat that cannot be ignored is its rapid spread and the severity of the diseases it causes. One of the reasons vibrio is particularly dangerous is its ability to proliferate in warm seawater environments, where people frequently engage in activities like swimming or beach tourism. Vibrio infections can occur unexpectedly and quickly, especially when you are unaware of the presence of the bacteria in your surroundings. Vibrio vulnificus, one of the primary pathogens, can invade through open wounds, even minor scratches, when you come into contact with seawater. This is especially dangerous for people with weakened immune systems, such as the elderly, those with chronic illnesses, or those undergoing cancer treatment. Initial symptoms may include abdominal pain, diarrhea, and mild fever, but as the bacteria grow and invade deeper into the body, they can cause rapid tissue necrosis, leading to severe damage to body parts. In the worst case, the infection can lead to sepsis, an extremely dangerous condition that can be fatal within days if not treated properly. Another concern is the increasing number of vibrio infections in areas like Florida, where the seawater temperature is warm year-round. Because of this, residents in these regions need to be particularly cautious, especially when engaging in outdoor activities near the coast. People who consume raw seafood, especially undercooked oysters, are also at high risk for vibrio infection. Additionally, a less discussed but still significant issue is the rise of storms and heavy rains during the rainy season. These events not only cause flooding, but also increase nutrients in seawater, creating ideal conditions for vibrio to thrive. Changes in salinity also contribute to the growth of this bacteria. It's important to note that not everyone exposed to vibrio will become infected. However, those with weakened immune systems, such as people with diabetes, cancer, or cirrhosis, are more likely to develop severe infections. For them, failing to control and treat the infection promptly can lead to serious complications such as muscle necrosis, sepsis, and even death. Therefore, preventing and early detection of symptoms is crucial. As a doctor with years of experience, I advise you that if you notice any unusual symptoms after coming into contact with seawater or eating raw seafood, don't hesitate to visit a healthcare facility for an evaluation. Although vibrio-related diseases can be treated if detected early, we cannot afford to be complacent. This bacteria can progress very quickly, and in some cases, delaying treatment can lead to serious consequences. To minimize the risk of vibrio, we need to maintain health awareness in our daily lives. A simple but important piece of advice is, always cook seafood thoroughly, clean wounds after exposure to seawater, and avoid contact with contaminated water. This will help protect you and your family from the potential dangers of vibrio. Latest statistics on flesh-eating bacteria in Florida, 2024 to 2025. According to reports from the Florida Department of Health, 2024 saw a significant increase in vibrio vulnificus infections, with a total of 82 cases and 19 deaths. This was the highest number in the past 3 years, surpassing the 74 cases recorded in 2022 after Hurricane Ian. Notably, in 2025, 11 cases were recorded, including 4 deaths. The mortality rate for sepsis caused by vibrio vulnificus can reach up to 50% if not treated promptly. Hotspots with high infection rates. Florida has many coastal and swamp areas, which are ideal environments for the growth of vibrio vulnificus. Counties such as Sarasota, Hillsborough, Lee, Pasco, and Pinellas reported high numbers of infections in 2024. After storms like Helene and Milton, the flooded areas created favorable conditions for bacteria to thrive. Causes of increased infections. Warming seawater. Rising seawater temperatures during the summer create ideal conditions for bacteria to thrive. Poor drainage systems. After storms, rainwater doesn't drain in time, leading to flooding and creating an environment where bacteria can multiply. Exposure to contaminated water. people who come into contact with seawater or floodwater may get infected through open wounds. Flesh-eating bacteria, such as Vibrio vulnificus and Group A streptococcus, are truly a danger that cannot be underestimated. These bacteria can attack rapidly, causing tissue necrosis and leading to severe complications, even death, if not treated in time. Being aware of the dangers posed by these bacteria, as well as the factors that promote their growth, such as rising seawater temperatures and poor drainage systems, is crucial to protect yourself and your community. We cannot afford to be complacent because even a small scratch can become an opportunity for these bacteria to enter the body. Especially during the summer or after storms, when seawater and the surrounding environment become contaminated, the risk of infection increases. Therefore, maintaining hygiene, avoiding contact with contaminated seawater, and thoroughly cooking seafood are simple but highly effective preventive measures. So, how can you protect yourself and your loved ones? It's simple. Always be cautious when coming into contact with water, especially when you're visiting the beach, participating in outdoor activities, or consuming seafood. Remember, even a little negligence can lead to serious consequences. Share this video to raise community awareness. Important information about flesh-eating bacteria, preventive measures, and the increase in infections in Florida will help people stay alert and take proactive steps to protect their health. Together, we can reduce the risk and protect ourselves from the hidden dangers of flesh-eating bacteria. Take action today to live healthily and safely.